For Action News, I'm Anna Delaski. An essay in the New York Times tells it like it is when it comes to diet and nutrition. It points out that demonizing one class of nutrients doesn't lead to better diets, and we've been saying this for years. Case in point, red meat. Dr. A.E. Carroll explains we've been reducing our red meat consumption for the last decade, yet we haven't seen the corresponding decrease in obesity or deaths from cardiovascular disease. He also points to a study where people were assigned 3 different diets: a low-carb, low-fat, and balanced. They resulted in similar weight loss, no clear winners or losers. So what's going on? ACTRA's Director of Public Health, Ariel Savransky, explains.
You can't just go after one food group. You can't just go after red meat and say, red meat is causing all of our nutritional issues and red meat is behind the obesity epidemic and just target red meat. That's really not how things work. He points out a study, which I think is probably one of the most important studies that he references in his article, done in 2012, that showed everything we eat is associated with both lower and higher rates of cancer. So I think the message really is that if you look at the decades of nutrition research that have been done, you can find any number of studies that are going to prove some association between a certain food and higher rates of cancer, or a certain food and lower rates of cancer. I mean, it's all observational research, and the fact is that it's all about calories in versus calories out. So people really need to work on, cutting back on calories, eating less red meat maybe, or eating smaller portions. But the fact is that it's really not just about red meat. It's about your diet as a whole.
To read more on this story and others, you can head to our website, action.org, and while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox.